212 Choices.
WOR New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, we're back. It's Dr. Lederman, and you can call us if you want. Noah's manning the phones, WOR, which is 1-800-321-0710. Doris, good evening.
Hi, good evening. Thanks for taking my call.
How are you tonight?
I'm okay.
Good. What questions do you have?
Well, I'm calling about a very dear friend. It's complicated. But he went in for vascular surgery about 3 months ago, and they aborted the surgery while he was on the table saying his creatinine level was too high.
Creatinine. Well, they would have known that before because that's how it's a measurement of the kidney function. So they knew that before the surgery, so why did they take him to surgery?
Well, 4 or 5 days earlier, the pre-op blood test, it was within a normal range, but 4 or 5 days later, when he was there for the cardiovascular work, it was elevated. They must have done another test. So they aborted it right then and there.
So tell me your question tonight.
Well, he also 2 weeks ago, he got this bursitis problem with a big bulb on his elbow.
Okay.
It's huge. It's been lanced. It's infected. It's completely affecting his lifestyle. So they took him in for surgery for that, to do a 6-inch incision and remove it.
Okay.
They didn't do it because of the creatinine level being high again.
Okay, so he doesn't have cancer, is that right?
7 years ago, he had a multiple myeloma, a stem cell transplant.
What I suggest is you call me after the show, probably tomorrow. There's 212 Choices, and we speak about the case. It sounds like he has multiple medical problems, and creatinine, kidney function, myeloma can be related. So just give us a call at 212 Choices. It's 212-246-4237 during the work week, and we can speak, or we can even meet if you want, okay?
Can I ask you if there's any other reason why one's creatinine would be elevated?
There's a million reasons why creatinine. The creatinine measures how the kidneys function. So you can have cancer. You can have antibiotics that hurt the kidneys. You can have chemotherapy that hurts the kidney. You can have high blood pressure that hurts the kidney. Certain infections hurt the kidney. Many, many diseases hurt the kidney. You can have even inflammation, which destroys the kidney. So the creatinine is only one measurement of how the kidney functions. It doesn't tell you why the kidneys don't function.
Right. Okay. Well, thank you.
Give us a call during the week. God bless you, and thank you.
Thank you.
Bye, Doris. And we have another caller. Let's put the caller through. How's Dan the man?
Oh, hi. How's it going?
Fine, thanks. What's cooking with you tonight?
Okay, Doc, first of all, you're on Broadway, and you're becoming the biggest show on Broadway. I don't care.
No, I'm not. I'm a little show on Broadway.
That's because you're humble, but you're becoming the biggest show on Broadway. First thing is first, it's amazing to me. I'm kind of fascinated by this field of medical science and stuff. First thing I like to throw out there, why aren't all the top people, instead of saying I'm better than you, why aren't we putting together all this information with the miniaturization of technology, of electronics, the ability to move information? Why are we not getting all this information together to really help the people? That's the first thing. The second thing is, when it comes to like the prostate and stuff, they talk about guys having prostate cancer and the ability to have sex after. Aren't most of these gentlemen, not all of them, but aren't most of them older guys? So wouldn't that be like a screwed kind of information when it comes to who is impotent or not, if it's older guys?
Well, first of all, I'll tell you a variety of things. Number one, we were the first ones to introduce stereotactic body radiosurgery in America. So when you do that, when you start treating cancers non-invasively and without chemo, without surgery, well, who are you offending? Well, there's every surgeon out there who earns his livelihood by cutting, right? So he doesn't want to hear this news necessarily. He doesn't want to be put out of business. And you got thousands of chemo people. They don't want to hear that there's a competing method of treatment that has a 90% success rate where we attack. So there's a lot of animosity, and many people will say the leading edge is the bleeding edge, because so many people are angry about new disruptive technology that disrupts the status quo. And that's what radiosurgery has done. It's upset the apple cart. All of a sudden there's a new technology where we can treat kidney cancers very effectively with a 90% success rate in the kidneys or in the lungs or elsewhere. Look, prostate cancer used to be the disease of the urologists or surgeons. And you just heard from a man who had a Gleason 7. He went to a big shot surgeon in Manhattan. He had surgery just months ago. He's impotent. His sex life isn't working. His urinary life is not working. And the treatment was a failure. His PSA is rising. So you think those people love me? I don't think so. I don't think they love me. Look, I'm trying to provide information to patients directly, and then the patient decides. I believe that the patient is the president of the United States of their body, and the patient should decide how they want to be treated. But you have to provide them with information. You have to tell them, for Gleason 7 cancer, we're 90%, and the surgeon is 60%. So where do you want to have your treatment?
Right, but here's the problem. As someone who gets diagnosed with cancer, I think they're devastated. So now not only do they have to look for the best doctor, they have to now, what I'm thinking, they got to look for an honest doctor who will come out and give them all the clinical studies out there and saying, well, this procedure is better. A lot of these people are so devastated by it. That's why I think the people out there, healthy people out there, I'm pretty healthy, should really start advocating. Let's get all this good information out there. Let's help these people out. Isn't there a certain oath that doctors take that they're supposed to be in the best interest of the patient?
And never do harm. And so you can say the surgeon that operated on this man's prostate harmed him because it wasn't the best treatment. Now, you can say that maybe the doctor didn't know. Maybe he hasn't looked at the data. Maybe he hasn't looked at our book. Maybe he hasn't looked at comparison. And maybe he doesn't want to look, because if he actually looked, then he'd probably feel pretty guilty about doing surgery on men when he knows that there's a better treatment out there.
Yeah, Doc, this show is fabulous. You are the biggest show on Broadway.
Well, I don't think so. I try to do my work. I try to respect the patients, return their calls, see the patients, and do the best I can. So thank you for your kindness, and stay in touch. And if you're in the Times Square area, come and visit.
It's the greatest show on Broadway. Maybe I will someday.
Okay, thank
someday.
you.
Thanks,
God bless you. Bye now. We have a patient who came to us this week, a woman with a 2.5 centimeter pituitary tumor. So it's another case. The pituitary gland is in the head. It's in the middle of the head. It's just by the optic nerves, the nerves that carry all the vision. So the danger is, of course, that the tumor or surgery can harm all the vision in the head, and we've certainly seen that happen before. Her tumor is 2.5 centimeters, which is exactly an inch, right in the middle, up by the nerves. She's been seen by a variety of surgeons. They've pushed her to have surgery. She has declined that for several years. She came to us, and she wishes to proceed with treatment, non-invasive stereotactic radiosurgery, which is a non-invasive treatment, which is very safe. No cutting, no bleeding. We were, by the way, the first in New York with brain radiosurgery, which is a non-invasive way of treating benign and malignant brain tumors. So we treat many benign tumors like acoustic neuromas, meningiomas, pituitaries, and we also treat many cancerous brain tumors like metastasis, glioblastomas, astrocytomas. We're going to take another caller. We have Rob from NJ. Good evening, Rob.
Good evening, doctor. Thanks for taking my call.
How are you tonight?
So, doctor, I'm a 43-year-old, pretty healthy, formerly very athletic male. I'm about 20 pounds overweight. I'm 210 pounds, just a shade under 6 foot. But recently, I've got back into shape over the last year, and I'm very muscular. Partially due to weight training, partially due just to being, bigger build. I run a lot, et cetera, et cetera. So,
okay.
I've had 15. I've actually lost count. I've had roughly 15 episodes of kidney stones, which turned out to be uric acid stones. And I've been on treatment for about 3-4 years, and I've not had an attack in 4 years. But I had 15 attacks between the ages of 30 and 40. And I also developed gout and had about 6 to 8 attacks. And allopurinol seems to be doing the trick.
Okay, great.
Here's my question. I went for some additional life insurance and was surprised to find out my estimated GFR was about 67 as of a month ago, and my creatinine's about 1.33, so a little bit high, but not. I don't know if it's alarming or not. But
Okay,
here's
what
my
we need
question.
to do... go ahead.
So my question is, I've gone to a urologist, but I haven't had all the follow-up work. So I've had two full blood tests of every test known to man: liver function, hormones, testosterone. Every single thing checks out beautifully, with the exception of GFR, in my opinion, is a little bit low. Actually, scary low in the 60s, in my opinion.
Yeah, it's scary low and your creatinine's high. So just give me a call after the show or during the week, the 212 Choices, because this show is devoted to cancer treatment. So give me a call during the week, 212 Choices, 212-246-4237. We'll talk about it and I'll help direct you, okay?
All right. My only question is there an elevated risk of cancer with all those uric acid stones?
I don't believe so.
Okay, I'll call then the other number. Thank you.
All right, thank you. God bless you. Bye now. And I wanted to talk about another man who came with a Gleason 7 cancer. Now, this man has a PSA 9.1, Gleason 7. He was sent by his urologist to us because the urologist knows our data. So bravo to the urologist. Actually, his name is Dr. Robert Gluck on 120 East 34th Street. Great urologist. He sent this patient to us, and we showed the patient the data. I showed the patient and his son the data, and they got to choose before treatment. And when they saw the data, of course, they're coming with us with just 25 treatments in the stereotactic frame and brachytherapy, which is our placement of seeds directly in the prostate through the skin. We don't touch the penis, the scrotum, the anus, the rectum, through the skin. Takes about 45 minutes, doesn't hurt. We could give some anesthesia so patients don't feel anything. And an hour later, they wake up and jump up and urinate and go to work or go home or go to lunch or whatever, but don't stay in the hospital. And for him, Gleason 7, PSA 9, he's looking at a much better future than if he had chosen radical surgery. And thank God for this urologist, Dr. Gluck. He was able to choose the best treatment with the best data and not have something else. So we're going to break for a moment. We have some voices to talk about the work we do. My name is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center. We're a private center at 38th and Broadway. We treat cancer exclusively. We have a spacious new center. It's right between Macy's and Times Square on Broadway. We're super convenient, but we're not only super convenient. We answer our phone. We return your calls. We know who you are. We'll send you a booklet DVD at no charge. We have 3 separate ones. We're close to the buses, trains, subways, Grand Central, Penn Central Station, Penn Station, PATH trains, and Port Authority. We have something called the Urgent Cancer Consultants, which promise you that we will see you within 1 business day because we don't think you should sit around and suffer if you have cancer. You can call us at 212 Choices. We accept most insurances, Medicare, Medicaid. The purpose of this show is to provide information so you have a better life, a better quality of life beforehand. The purpose of our treatment is to try to give you the best possible results, hopefully non-invasively. We do innovative radiosurgery. We were the first in America to perform body radiosurgery. We're the first in New York with brain radiosurgery. We perform hyperthermia, which is a kind of heating for select tumors. It's been known since the days of Cleopatra that if you heat cancers, you can help destroy cancers. You can call us day or night for medical questions, and if you want the booklets, just call us during the work week at 212 Choices. So we're going to break for a moment to hear from some voices about our work, and we'll be right back.
For cancer treatment, most prefer effective, non-invasive